Hello, and welcome to my mandated reporting presentation that is being done here in this week of our course. This is for the state of Virginia, and it's pretty short and sweet, straight to the point. Mandated reporting in the state of Virginia can be done by anyone who is under who suspects child abuse or neglect, also for elderly as well. But if you are identified in the Code of Virginia as a mandated reporter, it means you have received training in recognizing and reporting suspected child abuse and neglect. And you're required by law to immediately report any concerns that you may have pertaining to such things, and you report it to your local Department of Social Services. They have a list of local state of Virginia organizations that you can call. That if you go to the website at dss.virginia.gov, you can find a listing of those numbers. Some of the people who are mandated reporters due to their career are listed as such: persons licensed to practice medicine in any of the healing arts, hospital residents or interns, persons employed in the nursing profession, social workers, eligibility workers in a local department of social workers, probation officers, teachers or other persons employed in public or private schools, kindergarten or nursery school, persons providing full or part-time child care for pay based on a regular basis, law enforcement officers, professional staff, persons employed by a public or by a private hospital, institution or facility in which children are placed, persons 18 years or older associated with or employed by any public or private organization responsible for the care, custody, and control of children, mediators certified to receive court referrals, volunteer court-appointed special advocates, or CASA, persons employed by public or private institutions of higher education, athletic coaches, directors, or other persons 18 years of age or older, employed or volunteering with private sports or organizations or teams. That's the list that I have there, the short list, and pretty much that is what I have for the mandated reporting portion. That sort of goes hand in hand with what we do in our agency with the confidentiality. We are told, with each client that we meet with, especially the initial clients for assessments, that we go through the mandated reporting. What we are mandated to report is self-harm or projected harm to others, knowledge of child neglect, abuse, or of that of the elderlies. Also, the one added note is our clinical director really interestingly says, she's hesitant to even say that stuff because sometimes, files get subpoenaed and you have to disclose in those cases in a court of law or things of that nature. It's interesting the way she deals with that. She says, lots of times she gets, or time in the past she has gotten up on the stand and has all but had amnesia, I guess you could say, and trying to be as elusive as possible to keep confidentiality based on the exact content of clients. So she'll try to report on dates, times, things like that, attendance, participation, if she is called. And she does do her best to keep it as vague as possible in order to keep as much ethical boundary as she can with clients if she has ever been called. So that's pretty much it for my mandated reporting. This week has been actually on a kind of a slowdown for me. I'm starting to look at the last 4 weeks, as I'm sure many of you are, as my hours are nearing where they need to be. I'm starting to look at transferring clients and sorry, I just thought I had to let my dog out for a minute, but she walked away when I got up. I am also looking at terminating with some clients and how I'm going to go about doing that. I'm also working with another person, a former intern who's a program development. You know, we're developing the youth gang prevention program that he's going to be implementing here in the future. So that's what I'm doing here in Chesapeake, Virginia. So nice to see you all, and I'll be seeing you over the airwaves. Thank you.